Let's call this individual Ruby, and Ruby has lately been angry towards self, like a kind of internal anger, and is experiencing intense sadness. He's experiencing a kind of shame, self-blame, negative talk. He's not able to sleep. There is loss of energy, and it's like there's a kind of dark cloud over their head, and they cannot figure it out what is going on. Instead, they just self-isolate, they withdraw, and it's like they just decline into a valley, dark valley that's there is everywhere is just dark around them, and they cannot find a way of exit. And what I've just talked about is about depression. And my name is Dr. Debbie, I'm a mental health clinician. Thank you for tuning in, and today we're going to be talking about depression, understanding depression so that we can be of help to people around us, our loved ones, our friends, our peers, people in our community, and help them, to hold their hand and navigate ways of getting help, getting intervention, that this disorder, this mood disorder, is not going to stop them, it's not going to impact them so severely, and they can move on with their life, and together we can have a positive mental health. So depression is the clinical mood disorder, that is characterized by intense sadness and like sense of worthlessness. People just lose interest and pleasure in what previously have been giving them joy, and they see they see nothing, interesting again because of this situation that has come up of them. And due to this distorted degree of sadness, which some of them, as I've said, they describe it as living under a dark cloud or in a dark space that they cannot find a way out, and they feel stuck, like everywhere around them is dark because of the low mood. They have loss of interest, loss of pleasure, negative self-talk, when they remember, especially due to past traumas or some unpleasant incident that have happened in time past in their life, maybe during their childhood or at a particular time of their life. They feel worthless, and they feel ashamed of themselves, and this make them to self-withdraw into isolation, and they self-blame themselves, negative talk, sense of worthlessness, sense of hopelessness, which take away some sleep, from them, and it affect their sleep. And some of them, because of that, they just slide into just sleeping always. It's either they have increased sleep, or their sleep is taken away from them because of the hopelessness they are going through, because of the intense mood that disorder that is impacting them at this time. And because of that also, loss of interest, they feel tired, they feel exhausted, their appetite is affected. It's either decreased appetite or increased appetite, and then they feel like there's no energy, and some of them, even the energy to get out of bed, it becomes like a big deal for them. And at times people misinterpret the situation people are going through. They like kind of label them as being lazy, but it's just because of the emotional problem that they are going through, because of the clinical depression that they are going through, that has taken most of their energy, because they use those energy internally to fight this disorder, and then the energy is taken away from them because of this disorder, self-blame, hopelessness, and trying to get out of the dark space, of the dark valley that they've slipped into due to this disorder. It's not that just they are lazy, but a lot of things is going on in their life. And because of this, they are unable to concentrate. They have impaired decision making or increased forgetfulness. They cannot remember things, which impact their daily functioning, as well as their occupational functioning, their performance at work, on their job, on their business. And at times, even during that time, or maybe triggered by that loss of anything, you know, loss of job, loss of loved one, loss of precious items, loss of any part of the body, loss of health, you know, like illness, terminal illness, and all those, you know, could trigger depression or could exaggerate, you know, the symptoms of depression that makes people to feel hopeless and makes them to be angry internally. It's like a kind of aggression, a kind of anger turn inside, not to another person, and they use all their energy day and night, you know, to fight this mood disorder, which people do not understand and think that people are just being lazy. And at times energy, as I've said, to get out of bed becomes a big deal to this individual, and the emotional pain that they are going through, especially like I said, people that have gone through an unpleasant situation in their lifetime, or childhood trauma, or any type of trauma at any point in their life. And what can be the causes of this mood disorder, clinical depression? It could be genetic, it runs into some family, and you know, as people get into overwhelming situation or any incident, you know, in their life, this trigger, you know, the depression, and then they start to present with it. But there are some, if they don't have any overwhelming situation in their life, they may be able to go through life with in their lifetime without ever, you know, presenting or have to break down with depression. But if it is genetic situations, you know, that other people, maybe they will get a kind of internal strength, you know, to navigate it. They are not, because of the genetic predisposition. And as well is due to, you know, biochemical factors, probably, you know, endocrine dysfunction, such as the like thyroid hormone is very, very important. It helps, you know, it's a vital chemical that helps, you know, with our metabolism. And at times when it is low, it comes out with depression, and when it is high, you know, people are hyperactive, the other side of depression, like bipolar. And then also at times it could be due to abnormality of brain chemicals. You know, we have the brain chemicals. I've been following in some of my video that we have brain chemicals, the mood stabilizer, happy hormone, which is the serotonin. We have the oxytocin, love hormone. We have the dopamine, which is the reward hormone, and we have the endomorphin, which is the painkiller. So if especially the serotonin is low in some people, deficient, maybe due to some nutritional component, maybe because of these brain chemicals, and then it is low for whatever reason, people could come up with clinical depression, and they could be presenting with all the signs and symptoms that we have already highlighted. And then at times it is due to some structural brain changes, which could lead to, you know, organic type of depression that will come with like presenting symptoms of psychosis. And that is another category or another class of depression on its own. And at times, most of the time, is due to environmental, you know, changes, life stressors. You know, when people are in unpleasant situation, maybe poor poverty, maybe poor economic status, you know, job. At times, jobs could be very stressful and impact, you know, people's emotions, and they can come up with depression, or like as I've said, job or marriage, relationship, career, you know, business losses, when people lose huge amounts or something precious, you know, in their business, in their job, or as I've said, different kind of losses of loved ones, of item, of properties, of assets, of whatever in life, of health, of any body part, could lead to people developing depression and loss of health as well. You know, people losing their health, terminal illnesses, chronic illnesses that, you know, take a lot of energy, a lot of people's resources, could make them, you know, to end up with depression. Or like status adjustment during childbirth. You know, this is a new status, you know, that they've not gone through before, and then a lot of hormonal changes, you know, from pregnancy now to be a mom, postpartum, taking care of the new child, and the responsibilities and the hormones, you know, post the delivery trying to adjust could trigger also some people, developing depression. And as well as menopause, the stage that people get older, and then hormonal shifting as well, like estrogen and progesterone kind of imbalance could trigger some people at around that age, to develop depression. And at times it could be due to because of substance use that could trigger a kind of depression when it's like kind of impacts the brain circuit, and people after they hide side of the substance clears off, then the people just slide into depression. And it's because at times it could be caused due to lack of social support, especially like people immigrating from one place to the other in a new community, that their the culture is strange to them, and they are trying to adapt, they are trying to learn, they are trying to it's a lot to them. Or like young people getting to college, leaving home, going to school in a new environment, in a new city, new friends, new everything is new entirely. To navigate and learn new things could be overwhelming to some people, and could come up with depression. And at times it could be due to side effects of medications. So when you go to your doctor and you are being prescribed some medications, maybe for whatever reason, you need to ask whatever question that your clinician will be able to educate you and tell you about the benefits of the drug as well as the side effect. Like some steroids, it's been known to alter mood, and people could end up either with depression, or like the opposite side, which is bipolar or mania. Or estrogen components, estrogen is being used as birth control, also to balance some hormones, or for some treatment also could trigger alteration in mood. And even some anti-hypertensive medication for high blood pressure, there are some classes of blood pressure medication that could alter the mood and make people to kind of get depressed. So we need to find out. And also in young ladies, what we call premenstrual dysphoric disorder, like during the luteal phase of the menstrual cycle, like a week or 2 weeks to the menstrual period, like there's a kind of intense emotional disorder or depression and anxiety with irritability, mood swings, and fatigue occurring during this phase of the menstrual period, shortly before they start having their period, which is due to, as I've said, fluctuation of hormones during the menstrual cycle and impacting the daily life and relationships. And this also, if it is impacting their daily life, their work life and all that relationship, then we see a lot of people in our mental health practice and supports them with hormones, or like with some medications and some supplements as well, or just guide them education on certain things that they need to do, how they need to take care of themselves during that time, that they are not going to be overwhelmed and impacts them. And as well, at times generally, healthcare in human being is very complex, and it is possible, as I've said in some of my videos, that someone can have 1-2 different kind of illnesses, either mental illness or physical illness, and then there could be overlap. Like it's possible people have high blood pressure, then they still have diabetes with it. So, and also in mental health as well, people could have depression and still have some overlapping other mental health concerns, and at times they mimic each other. So that is the reason why it's advisable, and for this educational this information for people to be informed and be aware that how to seek help and get help and seek intervention. So at times the the depression may not just be the depression on its own, like, clinical or the classical depression that is just depression. At times it could be bipolar. When it is just depression, it means everything as a whole, because the brain is divided into two hemisphere, and at times, there is, so the depression is just that, for that episode, or for any time in that person's life, is just the manifestation of depression, which we call it unipolar, but at times it becomes bipolar. That is, they interchange, like during this phase, during this season, the person comes up with depression, and at another time the person comes up with bipolar. The depression is the lower side of the emotion, the intense sadness, hopelessness, fatigue, low, no energy, no interest, no pleasure in everything. While the other side is just the complete opposite of depression, which is the mania, and then the bipolar. So we said the two of them, one and unipolar and the bipolar, that is the two side of one item, like two sides of a coin. And then when during the mania aspect of the mood disorder, you see, the mood is exaggerated. The person is, very happy, full of energy, jumping from one place to the other, going to new projects, excessive spending, or getting into fights, talkativeness, and changing relationship from one relationship to the other, and so many risky things that people do at that time, that people do not know that they are really sick. And then they think that, oh, that person is the life of the party, is outgoing, is this and all that. Or the person can becomes like, if it is the aggressive type, picking arguments, getting into trouble. And it is around that time that people get into trouble with law enforcement agents and all that. And it is when it's becoming something happening repeatedly, that maybe while they get into the hands of the law, that they want to check and see that this person is actually sick. Because during that time, people enjoy that high energy, and they do not see the need to seek help. It is when most of the time people seek help during the time of depression, because it's just like I said, getting into the valley, and they are looking for help, because they cannot find a way. And that is where most of the time in bipolar people look for help. And most of the time this is always missed if there's no good history taken. And that's the reason when you go to see your clinicians, they ask a lot of questions about your life, about your childhood, about everything, and you'll be wondering, we just want to know which phase, if it is pure depression or maybe bipolar. Because if it is not specified at that time, it could trigger, if it is the time that they think it is depression, that most of the time people seek help and they give the medication, to boost the mood, then it's just trigger the bipolar. And it's always difficult. It's like, you pour a gas into a burning house, it's going to explode, and we don't want that. So we always want to ask questions, if there have been a season like this in your life, that you have a lot of energy, you are so happy, you are getting into so many projects, into so things that you did not think through, and it is important that you share with us. And in mental health, everything is confidential. Whatever you share with us is for health, except it is something that impacts the life, the safety of you or safety of another person. Other than that, we keep it very confidential by law and by our training and by the profession. And as also, like, with that, and at times it overlap with all other conditions like ADHD, that is attention disorder. Like most of the time before, it's with children, that it affect them. So it's a kind of hyperactivity and inattentiveness, and you see children jumping here and there, they're fighting, they're destroying things. But most of the time it is missed as well during childhood, like after 12 years. And after many studies and research, it's allowed to be treated in adulthood because it is missed. Maybe their parents or their guardian, they do not have the understanding that that individual was presenting with ADHD, or like past trauma that I've said that has happened at one time or the other. So we're able, with good history taking and a lot of assessment and evaluation, we're able to see what actually is going on. And if they are overlapping, that the depression is there as a mood disorder, we want, or if it is bipolar, I want to treat that first before we treat the second part that is being like a comorbid, like like roommates that they are living together. So but the important one that we see as very vital is to take care of the mood first, and while we start the intervention, the treatment for the mood, then we can see better clearly the presenting symptoms of like the ADHD or the PTSD or the adjustment disorder, maybe due to childbirth, maybe due to menopause, maybe due to whatsoever is going on. And then we get the person, we hold the person's hand and get the person back, to where they ought to be in life, in their mood, in their emotion, in their performance, and we want everyone to be happy. So I hope you learned something, and that's why we're bringing this educational this information across your way, so that you can be aware of signs of depression. You can understand what clinical depression is about. As I've said, it's not laziness, and help is available, and we can help people, we can help our loved ones, we can help our friends. When you notice any of the signs that we have already listed, you can call the attention that, oh, I think you need to talk to a mental health provider, you need to talk to a licensed board certified practitioner to help. And because at times when they get dark, when it gets darker and darker for them, things can turn sour, it can go south, and we don't want that. We want everybody to be happy, we want everybody to be alive, we want all of us to enjoy positive mental health. So in our place of work, our peers, our friends, loved ones, our family members, our colleagues, in the community, wheresoever we can find any of these symptoms in people, let's support them. Non-judgmental, don't label people, hold their hands and direct them in the right path for them to get the help. And as I've said, my name is Dr. Debbie. I'm a mental health clinician. I see lots of these people, and I'm so happy when the people are recovering and they start to tell the impact in their life, that the attention they've not been giving to their health before, that they've not, now they are able to give attention, the concentration, and recovering again, enjoying the pleasure they've been enjoying before in life, things that have been bringing them joy before, they are able to bounce back fully, and they are happy, they are grateful that they can enjoy life again. So let's support one another. I hope you learned something, and until I see you in my next video, be safe and have a positive mental health. Bye.